Hello, my name is Savannah Hallam. I'm an occupational therapy assistant student at the State College of Florida, and I'm going to demonstrate the dermatome for C7 for spinal cord injury. And I'm going to talk about the functional changes for somebody who has had a spinal cord injury at level C7. Then what else? We'll do the sensory testing with light touch and sharp dull discrimination. Um, yes. All right, here we go. So this is the dermatome. It's much lighter on this hand. You can still kind of see it though. It extends all the way to the very distal part of the phalanx on the third finger there. So the dermatome is on the dorsal surface of the proximal phalanx of the middle finger. So testing occurs all in that area. And surrounding C7 is going to be C6 and then C8, which I believe is important when thinking about function in individuals with an SCI at C7 because the muscles, the flexor and extensor muscles that allow finger flexion and extension allow for an individual to have more grasp than ever before with this type of injury. So that's a really good thing. Next is the sensory testing. Let me grab my cotton pad. This is the light touch. So I'm going to touch it over that surface. I would show the individual what I was doing on myself first, then I would have them look away. Do you feel it? They say yes. Then sharp, dull. You rub the dull edge. You would do both sides, of course. Okay, and then dull edge. Sharp and dull. Okay. Let's see. One of the things we talked about finger and finger extension and flexion, and then one other important muscle movement that occurs with C7 is the functioning tricep, which gives the individual elbow extension. Yay, I can push up. That is great news because it helps that individual with pushing up for transfers, pressure relief, and propelling their wheelchair. This individual at C6 allowed for wrist extension, which we know allowed for the tenodesis grasp. So building off of that, C6, C7, the individual is getting more functional grip strength and using adaptations for grasping items. And they can use the adaptations or items independently, like for self-grooming, writing, holding tools, brushing their teeth. All right, so next I'm going to talk about some of their functional challenges. So from here down, their trunk, legs, bowel, and bladder, they have no control over of if it's a complete spinal cord injury. If it is incomplete, they may have limited movement. Let's see. So they'll still have reduced endurance from impaired respiratory muscles. So they may need help with um, coughing out secretions or getting their secretions out. Um, they may have decreased sitting balance because those trunk muscles are affected, and then they will have reduced grip strength, but the ability is there. Okay, for some adaptations, they can use built up handles. For grooming, riding, just makes them easier to grasp the object. They can do a lot of their own safe positioning and mobility now. So, whether that's from the bed to the wheelchair or the wheelchair to the car, which is an important part of C7 because they have wrist extension and flexion and finger extension and flexion, they now have the use of hand controls. So they can be seen by a certified driving rehabilitation specialist and hopefully begin to explore community mobility with that independence. Let's see. So, all of those movements and then also wheelchair skills training would be an important focus for occupational therapy to educate on pressure relief techniques and energy conservation strategies for their self-propelled wheelchair that they can do. Let's see. I think that's all. Thank you for listening.